Yeah, so let's kind of dive into it. One of the things I saw the most at your clinic was kind of we dealt with, of course, a lot of dementia, and I
Yeah,
feel I have parents that are elderly, like this is their ultimate fear of potentially getting dementia, and I feel like kind of more non-medical people always think of dementia strictly as memory issues. And one thing
right.
that I kind of saw first thing at your clinic was kind of mood changes as well associated with dementia. So I guess why is mood also impacted in dementia?
Well, you have to understand that, first of all, a lot of the dementia is not necessarily something, I think people just assume and get jaded by the idea of a diagnosis of dementia because it's a disease. But the thing is, we've we all have dementia, to be honest. You have to think that our body's been deteriorating since we peaked on average, which is around 25. And so, it's been downhill since then. And that our brain volume shrinks, it peaks in the growth at 25. And then ever since then, it's been shrinking. And that's, well documented on all the imagings and well understood, but people don't tend to realize that. And as your brain shrinks, yes, is it going to affect your memory? Absolutely. No one will be able to tell you that their memory is better today than it was 10 years ago. And that's just reality. And if anyone says they do, guess what? They're lying. Because your brain physically is shrinking, your connections are becoming less, and therefore it's just generally, I guess you have your exceptions to the fact, but generally it's not physiologically possible. Let's put it that way.
Hmm. Okay.
And so if your brain shrinks, all functions shrink, and that's not just the memory part, the behavior, your vision, your strength, everything.
Hmm.
And so that's just the process of aging. Can you fight it? Absolutely. We always encourage socialization because that's practicing your short-term memory. You have to remember who you're talking to, so their names, so that you can be polite and say goodbye with their name. So that,
Yeah.
instead of like, oh, I forgot what's your name again. It's kind of rude, right?
Yeah.
So socialization is practicing short-term memory, and so with the memory loss, obviously you're going to have all the other losses gradually too. And so it is basically, dementia comes in when at a point where you no longer have a way to compensate for what you forgot. Let's just put it that way.
Okay.
That's the way I tell patients. So it's like, we forget, if our just think of it as a circuit, right? And you have neurons on each, and they're all interconnected. And if you lose one neuron and all of a sudden that connection is lost, guess what? You can still reroute it around to get to that same neuron, which is what a lot of times what we do, right? Because if you're a visual learner, then you know you're like, you remember faces. And so even though I might have forgotten your name, once I see your face, your name pops up because I rerouted that memory to remember that.
Hmm.
Well, when dementia comes up, guess what? Even that reroute is no longer there. So that's when there's that disconnect. And so when you have that disconnect, then you start not able to do a lot of your daily stuff, pay your bills, or, obviously
Yeah.
you forget.
Interesting.
That makes
Because
sense?
yeah, I mean, and kind of, I guess the answer I thought you were going to kind of say is one of the best ways to avoid dementia is with exercise, because I think of a lot of dementia processes as restrictive of blood flow, not getting enough blood to the brain. But, when you were kind of talking about socialization, the first kind of thing that I popped in my mind is like, wow, I wonder if there's going to be worse dementia or short-term memory loss during times of COVID because we're socializing much less than we would traditionally.
And the answer generally would be, the assumption would be yes. And and don't get me wrong, you're absolutely right. The exercise thing has been well proven. The exercise definitely slows down dementia, and obviously, the brain needs energy, and your blood supplies the energy to the brain. So if you're healthier, you're able to supply more, and therefore, you know, it will slow down the cell death.
Hmm.
That's pretty straightforward. And so, yes, I mean, I just want to make sure, that's
Yeah.
so, but yeah, it's, why do you think right now there's such a huge push of, wanting kids to go back to school,
Yeah,
right?
I mean, I didn't even really think of that. I kind of just thought of it more as like of a developmental standpoint, but not really necessarily like a brain process, at least memory
But
process kind of thing.
it is a developmental process, and it is making those brain connections that you know that makes your memory better, that makes you, you know you don't realize that socialization tends to, you know bring on a lot more, promote a lot more other uh, mental health issues, like, including not just learning, but just, behavior, and that's all related to connections in your brain, because your brain, how you behave, which we'll talk to about when we get to TMS,
Hmm.
but same thing. It's all about the neural connections, and you know how big your prefrontal cortex is, and how significant what that means, and it's all related. I mean, you can't get away from the science. It's pretty, it's been pretty well studied and understood.
Yeah.
So,
Yeah. And actually, a month or so ago, I just completed a child and adolescent psychiatry experience. And yeah, it radically changed kind of my attitude towards coronavirus and getting kids back in school, because I saw firsthand the destruction that it's causing, and kind of isolation, and of course in the world of psychiatry, I was thinking more just on moods, but not so much really on memory processes and learning. And so yeah, to kind of hear you say how much socialization can impact all of this is, I just hope we can get kids back in school safely as soon as possible.
oh, absolutely, me too. But the key word is safely.
Yeah, yeah, keyword. Absolutely. Absolutely.
Risking parental death or grandparent death or the kid's illness is sometimes not necessarily worth it. Just saying.
Yeah. Yeah,
I mean,
absolutely.
a year in the life of a normal person is just a fraction compared to, you know
Yeah.
sudden death.
Exactly. Yeah, the worst case scenario. Absolutely. Yeah. So well, so also one question I get, I feel like a lot from, quite frankly, my parents and other people kind of in their same age, should they be taking any like supplements? Like, are there certain vitamins that are going to be better to avoid dementia processes, especially later in life?
And so the answer to that is always yes, but not in the sense that, hey, whatever's out there, oh, do we go buy all these, dedicated supplements that supposedly make your memory better out there? If you look at the ingredients, it's just vitamins.
Hmm.
but
Yeah.
the don't get me wrong, vitamins are crucial, and it is because they're cofactors to how your cells work. And if you can optimize that, that is always good. But that doesn't necessarily mean that you can't get that from just what you choose to eat. Um, so there hasn't been any particular things that's been shown to be, oh, you need to definitely take this supplement or else you'll get dementia. I mean, there's not, because your
Hmm.
body naturally supplies the nutrition it needs. And that's not going to change. So it's kind of like the old saying of often the questions I get about, traditional medicine and, traditional medicine and versus, Western medicine, right?
Hmm.
Um, it, I always say, yeah, traditional medicine is fine, because what traditional medicine is basically ingesting, you know, plants and stuff that where the Western medicines derive their medicine from anyway. So it's
Yeah.
like if you're eating well and healthy, then you're optimizing your body to fight off anything bad anyway. But in terms of when you have a acute disease, is Western medicine gonna cure that? Not usually. Just saying.
Mm-hmm.
It just needs something more drastic and more potent, I guess. And
Okay.
so, in that sense, the answer is, yeah, eating well is fine, but no, there's not any particular supplement that needs to be taken,
Yeah.
unless you're deficient in it, obviously. And
Mm-hmm.
which is the reason why we screen people for B12, because B12 deficiency definitely can cause a pseudo dementia type behavior. So
Yeah. Yeah, and I, especially for the senior citizens, I know a lot of them, of course, are on like a fixed income that's probably rather low, and sometimes a lot of those vitamins can be quite expensive. And it's
yeah,
like you can get a lot of those same nutrients if you just eat very healthy, getting folate, from like spinach kind of thing. And just so, I kind of think it's a mixed bag. I kind of agree with you.